Megamind.
Good afternoon, everyone.
First of all, thank you, Megagen, to give me this opportunity to stand here and share my knowledge. Secondly, is the huge thank to my mentor, Professor Thomas Linkevičius, because this case I'm showing we are doing together, and I'm honored and very thankful him to support me and to be my mentor. Now, the presentation is about we're trying to find out which material is the best for individual healing abutment, and this is my case about. So, first of all, we just submitted the article, and we already know that using the connective tissue graft from the palate and augmenting the soft tissue vertically, you may gain about 2 millimeters soft tissues vertically. The article we submitted recently, meta-analysis, another one, we know that using the same procedure and augmenting the soft tissues using the connective tissue graft, you may gain horizontally about 1.3 millimeters. And since then, we already knew the new case series we're going to do, trying to find out which individual healing abutment material is the best. We will definitely use the augmentation of the soft tissues. So the aim is to identify which material is the best for individual healing abutment, the zirconium, is Emax, or PMMA. So now, going back to the case, first of all, we need to see the patient and evaluate the primary situation. So the tooth, the gingiva, the buccal bony wall, the occlusion, the symmetry of the gingiva, and all other aspects. If the patient is suitable for us, we can accept this patient to our case series. We move on. We're doing the cone beam CT scan and scanning intraorally this patient. So this is the case. Female, 67 years old. She's have no health complaint. She's only complains about moving bridge from tooth number 12 to 22 and inflammation process in the root tooth number 12. So we accepted her to the study. We move on to the cone beam CT scan and already started to plan our case. First of all, the implant positions. And according to our treatment plan, we are placing our implants 3 millimeters deeper according to the edge of the palatal wall, trying to leave at least 1 millimeter thickness of the palatal bone. When we already planned our implant positions, we move on, and we are planning the individual healing abutments forms. So we want to replicate exactly the same form as the root we still have in the mouth, in order after the surgery we would have the same tissue contour. And when we already have planned our implant positions and we have planned already our individual healing abutments, how they're going to look, the shape of them, we move on and prefabricate those things. We prefabricate the individual healing abutments, the surgical guide, and the aligner for the temporary solution of our patient. Let's move to the surgical part. When we have already those components, we move on to the surgical part. We replace the hopeless teeth. And with the help of surgical guide, we place the implants. As I already said, the implants are placed 3 millimeters deeper according to the edge of the palatal bone. And move on to the second stage. The second stage means that we need to take the connective tissue graft and we need to place it between the periosteum and the rest of the soft tissues. So we're harvesting the soft tissue from the palate. We place it in between the periosteum and the rest of the soft tissue. The gaps between the implant and the bone will fill with the allograft material and placing the individual healing abutments on top. In this case, on the left side is going to be zirconium. On the right side is going to be PMMA. After the procedure, we're doing the parallel dental X-ray just to see did we accomplish everything as we planned under our treatment protocol. And suturing everything. This is how the wound looks in the palate. This is how the situation after 2 weeks looks like. This is the wound in the palate after 2 weeks, and this is the situation after 4 weeks. What we're trying to find out, we're trying to find out some parameters we are measuring. So as recently it was shown, we're measuring the pink aesthetic score, we're measuring the plaque accumulation, we're measuring the bleeding on probing, and we want to see how these materials will react and have a correlation between the soft and hard tissues. This is the issue we want to find out. So the case is done, but I still would like to share 2 more cases and show the 4-month results we have. This is one of them, and it's interesting because one patient has 3 different materials, individual healing abutments in the mouse at what time. So it's zirconium, Emax, and PMMA. And this is on the left side, it's the just after sutures removed, and on the right side we're having already 3 months left, 3 months after. So from the occlusion side, how it looks, the zirconium, when we take them out, the abutments, you can see a slight difference. And actually the zirconium soft tissue, when you take out the individual zirconium abutment, it looks, for my eye, it looks much better compared with Emax and PMMA. Let's check out how the individual abutments looks like when you take them out after 3 months. As you can see, it's visible even with your eye that the plaque and the calculus stays on Emax. You can see, I can see probably on the picture, you cannot see that PMMA also accumulates some plaque, but almost no plaque in zirconium. When we put some hydroxyperoxide on top on them, we see a huge reaction on Emax, almost no reaction on zirconium, and slight reaction on PMMA. So let's look how the bone reacts to those materials. I mean, not directly, but when they surrounded by the soft tissue and soft tissue just preserves the bone, we can then simply get some opinion about those materials. So PMMA on the left side, just after surgery, then after 3 months, after 4 months, you can see that we have the bone remodelation is going on. And other 2 materials, zirconium and Emax, on the left side is zirconium, then on the right side is Emax during the stage at the surgery, 3 months after, 4 months after. You can see that also where the Emax was placed, we have a slight resorption of the bone and remodelation. And at the zirconium side, the bones looks better. Another case also is accomplished already 3 months past. We had to replace tooth number 12. This is the final result already with the final crown. The aesthetics is still on the way. But when we took the abutment after 3 months, we saw that the connective tissue is attached to the zirconium. This is also a very good sign. And how the radiographs looks like. So at the day of the surgery, 3 months and 4 months after, the bone looks pretty good. So I cannot make a conclusion at the moment because we are still on the long process, but I think in the future we will share the findings we find out, and probably it's going to be very interesting. So thank you once again very much for your kind attention, and take care and have a good evening everyone.
Megamind.